Hello and welcome to Pregnancy Info. Today we are going to discuss the signs and symptoms of head fixing of baby during pregnancy. Toward the end of pregnancy, your baby will likely get into a head-down position so that they can begin their descent into the birth canal. The exact timing of when your baby hits this position is individual, and some babies prefer their other positions like breech, mean head up, or transverse side laying. The question is that when it generally occurs. Most babies tend to shimmy their way into a cephalic or head first presentation before birth. Your baby may move all over the place in the first and second trimester. Their position may change wildly early on the third trimester as well. At 28 weeks, around 25% of babies are breech, but this drops significantly later in pregnancy. If you are in your third trimester, you may notice your baby staying put in a head-down position. Your uterus grows to accommodate their size, but there's only so much room. As time passes, your baby gets bigger and starts to run out of space to move into different positions. There are some types of head-down positions. Being head-down is just half of the equation when it comes to birth. There is also the matter of which way your baby is facing. Why does this make a difference? It comes down to geometry. Your baby's head must fit through the pelvis on its way into the vaginal canal for delivery. Some positions make this journey easier than others, especially considering how different parts of your baby's skull are wider and narrower than others. There are two positions your baby might be in. Number one, occiput anterior. This position is the most common. It means that your baby is head down with their back against your stomach and their chin tucked into their chest. Occiput posterior. This position means that your baby is head down but facing the opposite direction. In this position, your baby's back is at your back. Anterior is considered the ideal position for an uncomplicated vaginal delivery when your baby's chin is tucked. It helps the narrowest part of their head go through the birth canal. Posterior presentation can sometimes mean a longer or more complicated delivery. Signs and symptoms that it has happened. You may not experience any sign that your baby has flipped into a head-down position, and there is no easy way to tell just by looking at your bum. Fortunately, your doctor or midwife is trained to feel for your baby's position using what are called Leopold maneuvers. With this technique, they will feel for what part of your baby is presenting in the pelvis, then for your baby's back, and what part of your baby is on the fundus. This can also use an ultrasound to confirm your baby's position. Additionally, your doctor will feel around for your baby's cephalic prominence, which simply means which way your baby is facing. With the head down presentation, baby's head would be in your pelvis. Baby's back position would depend on whether baby is posterior or anterior, but generally baby will have either their back to your belly or your back posterior. Baby's bottom or legs would be in your fundus. But how can you figure out your baby's position at home? Pay some close attention to the shapes in your belly as well as the different movements you feel. Your baby may be head down if you can feel their head low down in your belly. Feel their bottom or legs above your belly button. Feel larger movements higher up towards your rib cage. Feel smaller movements low down in your pelvis. Feel hiccups on the lower part of your belly, meaning that their chest is likely lower than their legs. Belly mapping. It can be difficult to read the different lumps and bumps you feel on your stomach, but with practice you may start to understand what you're feeling. To use this technique, wait until you are at least 30 weeks pregnant. Lie down in bed in the couch and use a washable marker or finger paints to gently mark where you feel your baby's head. The arms and hands are likely near the head, and their tiny movements gives them way. And then feel for the back, butt, and legs as well as larger movements. Lightly draw or paint your baby on your stomach to help you visualize how they are lying. Options for babies that are not yet head down. If you are in a late pregnancy and have concerns about your baby's positioning, ask your doctor about what is next prenatal experience during your appointment. There are several options for delivery if your baby is in breech position or another position like wait and see approach, external cephalic version, cesarean delivery, vaginal birth, etc. The baby moves a lot throughout your pregnancy. As you doctor closer to your due date, they are likely settle into a head-down position as they get ready for birth. If you have concerns about your pregnancy positions, don't hesitate to bring them up at your next prenatal appointment. Your doctor is also keeping tabs on whether baby is head down and can help guide you with options for repositioning and alternate birth plan if necessary. So this is all about baby's positioning and when and how the baby will fix their head and what are the signs. Please share this information with the female friends who are going to expect, and I want to know that and the baby's head will be fixed. Thank you. Take care. Bye-bye.